Hey everyone. Here's another video. During this video, I want to talk about this month. May is a National Mental Health Month. I'm looking away because I'm looking at my screen so I can stay on track. But this month we celebrate National Mental Health Month, recognize it, right? For all the people who live with mental illnesses. So I'm just going to kind of run through some of the mental illnesses that you are most likely aware of and how they affect people. And I'm going to probably talk a little bit about treatment options for those disorders. So the first one is anxiety and panic disorders. So where do all these names and disorders, depression, eating disorders, schizophrenia, bipolar, all of these are diagnoses that are in the DSM-5, which is a diagnostic manual for providers, psychiatrists, mental health workers. This is what we call like our Bible to diagnosis and treatment of various disorders. So, for example, under anxiety and panic disorders, there are subtitled disorders, right? You can have anxiety, or you can have social anxiety, where the person has difficulty being in social situations. So overall, anxiety disorders and panic disorders cause the person to feel afraid in different situations. And treatment is available for the people who have been diagnosed with an anxiety disorder or panic disorder. And those diagnoses come from a psychiatrist, or in some states, a nurse practitioner or a psychologist, or a clinician. A master's level clinician with a license can also diagnose disorders, but it really all depends on the state in which you live in. But overall, no matter what state you live in, we all use the DSM-5 to give those diagnoses and follow a treatment. And so, someone who has anxiety disorder can, maybe prefer not to take meds, and so they try other treatment options to decrease the symptoms of the disorder. Bipolar disorder is not somebody with two personalities. That's probably the biggest misconception about someone who has bipolar. Doesn't mean that you one day or 1 minute you feel happy and then 5 minutes later you're mad. It's not like that. Someone with bipolar disorder simply means that they have times of being manic, and having a manic is feeling, it's kind of like being hyped up. Like you're manic, you're hyped up, you feel like you can conquer the world, you just got all these wonderful and great ideas that you're going to do, with no real plan, right? So that's somebody who's manic, in a manic state during they have bipolar, but they're manic, right? And so then the other side of mania is depression. And depression is the feeling of sadness, loneliness, hopelessness. It could be suicidal thoughts as well. A person may have suicidal thoughts. So usually somebody who's bipolar, they may be manic for 6 months, or they may be depressed for 6 months. and it doesn't interchange within days and minutes. It's more of a longer period of either state. I know I've treated people with bipolar, and people with bipolar, the mania, they don't mind the mania. And I'm saying from my experience working with people with bipolar, because the mania gives you this burst of energy like you never had before, right? The issue, and a lot of times, is that they become very impulsive, right? So, for instance, they may, make really bad financial decisions, definitely make really poor relationship decisions during that manic phase. And so mania, I have personally had clients hospitalized during mania, even though they're like, oh my God, I feel great. I can conquer the world. You know what? I think I'm going to be a psychiatrist, or I'm going to school to be a doctor. So they have all these like fantasies and dreams, but it's based in this manic state. And that side of depression can be very difficult to treat someone with bipolar too, because they can go really low, and during that low state they can be depressed and suicidal and have suicidal thoughts. So in the DSM-5, it lists bipolar 1, bipolar 2. There's different types of even bipolar. On some extreme cases, someone can be bipolar with psychosis, meaning so now they may be manic or depressed, but now they're hearing voices. They're delusional. Cases that I've seen, patients become very grandiose in their delusions. So they may feel like, they're the mayor of a town, or they can pick up the phone and call the president if they wanted to. So I've seen that, and I've treated people who have been in that state of bipolar with psychosis, which is more rare, but it does happen. And then there are eating disorders, and most of us know what those are: bulimia and other types. It's completely blowing out of my mind now. Bulimia. Oh, anorexia. I'm sorry. And so eating disorders are very difficult to treat, but treatable. And so it's an unhealthy relationship with food, basically. And people who deal with these disorders have an image of being overweight, or they don't want to be overweight. And so then they deprive themselves of food, either by throwing it up or taking laxatives. Binge eating is another type of eating disorder. Eating disorders are probably one of the most difficult mental illnesses to treat. Is it treatable? Absolutely. But I would say if you have been diagnosed with a eating disorder, that you go to a clinician or a doctor that specializes in eating disorders. These people will know what they're doing in helping you and treating you. Not every clinician can provide the best treatment for someone who has an eating disorder. I think my opinion would be that you go to somebody who specializes in eating disorders to get the best treatment. And then there is schizophrenia. And so if you go back to the DSM-5, there are different levels and types of schizophrenics. Usually in practice, I've worked with people who were paranoid schizophrenics. And paranoid schizophrenics, I've never met a schizophrenic who did not hear voices. So these people hear voices, they talk to themselves, They see things that other people don't see. They're delusional in their thinking. It is very difficult. It's a very difficult disease to live with. But in the last 20 plus years that I've been working in this field, I've seen so many promising people with the disease who are doing so much better because of medication. So I would say that medications have improved over the last 20 plus years and given people the ability to have a better quality of life. And so that's the good news to me about schizophrenia. I watched people who were nonverbal, hearing voices, not capable of working or, having even building relationships or friendships, take certain medications that have improved over the years and have a much better quality of life, that they can work, they can have their own apartment with some support, where 30 years ago they would have never been able to do that. So, schizophrenia, although it's very difficult and there's different levels of the illness, there's been progress, I would say, with the use of medication, talk therapy, and support for schizophrenics. One of the issues with schizophrenics is the paranoid piece. And so sometimes they don't trust the medication. They believe it's poisoned or someone's, oftentimes they say it's poison. And so they don't want to take it. And that's going to be a problem because if they don't take it, their symptoms get worse. And oftentimes they end up on the street, homeless, because they're afraid to go into the hospital. The voices are telling them that, your family is no good. They're going to kill you. You can't trust them. Don't eat the food they offer you. And so without the assistance of medication and treatment, oftentimes we find that they end up on the street. And then under mental health also is substance abuse and addiction. And so that's a whole nother level of treatment. In this country that we are dealing with, in other countries as well, but we are dealing with the opiate crisis. And so people are addicted to opiates. Oftentimes it's almost an innocent type of innocence that got them to the addiction. So, maybe for example, someone may break their ankle and they go to the hospital to get treatment. Very painful, right? You break a bone, it's painful. And so the best treatment is an opiate, right? But opiates are set up to be a short-term pain management. And what happens is people become addicted to it. And so with that addiction, your doctor is only going to prescribe you maybe 30 days or 10 pills or whatever. And once that addiction kicks in, you want more than that. And so opiates are, if you can't get an opiate like a perk or oxy from your doctor, then the next thing is to buy heroin on the street, right? So you're looking at someone that never had an addiction before, or maybe they had some underlying genetic issues regarding substance abuse, and this kind of opened it up. And so then the next thing you know, they're on the street buying heroin, right? Or shooting up heroin within, from sniffing it or whatever. So opiate addiction is a huge issue in this not only our country in the United States, but all over the world. So then we have people under mental health that end up going in the hospital. And sometimes, a lot of times, people with mental illnesses already um, have another, end up become abusers. So now we call that, they have a dual diagnosis. So now when they go into the hospital, um, they need to get treated for the mental illness and the substance abuse, right? So now they're battling two demons, right? And trying to manage that. So let me see. What is the most difficult disorder to treat? Um, a lot of clinicians would probably say borderline personality disorder is one of the most difficult disorders to treat. Um, I agree with that. I personally, in practice, don't I avoid treating people with personality disorder, um, borderline personality. It's just too difficult. I really, honestly, they are very much, honestly, I call them, they're just shit starters, right? They they like to keep stuff going. Um, and destroying things along the way, family relationships, personal relationships, professional relationships. So I would say that, and it's hard to spot. Because a lot of times they can be very manipulative. So they come into your office or in for treatment and tell you this story, where of course they're the victim, and it's difficult. Is it out of the realm of getting better? No, they can get better. They can improve their life and their existence, but um, it's not easy. It's not easy. And again, I would say you need to find a skilled clinician or doctor that is able to treat that illness and diagnosis. And they're out there. The clinicians like that are out there. I'm probably just not one of them, but they out there. Um, uh, what is the most dangerous mental illness? Anorexia is probably, according to what I'm looking at, anorexia, and I think that is because the anorexic is they're losing weight, or they're thin. Um, I don't think people recognize that it's gotten bad until they're like so thin that they're like a skeleton, and then that's when family and friends are like, something ain't right. Right, you real skinny, right? And that's when family and friends are like, I think she needs help or he needs help. Um, and at that point, it's difficult. It is very difficult, and people die from being anorexic, um, because of the lack of nutrition. They're just not eating. Um, so yeah, that's probably the most deadly. When I say dangerous, I mean the most deadly disorder, schizophrenia, just because of the lack of support that they get, because oftentimes they live in the street, um, and so they're not getting, medically what they need. They're not getting their mental health needs taken care of. Um, but yeah, but I tell you, if a schizophrenic gets on the right medications, you see a significant change that improves their quality of life. So So, how does mental illness affect the brain? So, that's a question that people want to know. Like, why is this happening to me? Why is this happening to my uncle or my mother? And I think the best way, or the way I explain it to people, is it's a chemical imbalance, right? Without giving someone a whole science test or like talk about the brain and how the brain works, it really, it's something that you didn't do to yourself, right? You didn't wake up one day and say, you know what, today I'm gonna be bipolar. Like you didn't do that to yourself. It's the same way if you woke up and someone told you, you went to the doctor and they said you have MS, or you have any diagnosis, any disease, arthritis, whatever. Mental illness is a diseases of the brain, right? So the brain is an organ just like every other organ in our body that can become sick. And that is what happens with people who have a mental illness. Certain parts of their brain become sick, and it shows itself through the symptoms, right? And over time and over these years, in the world of psychology and psychiatry, we have just learned how to figure out if the person is doing these things, then this is the diagnosis, right? So if you are feeling sad and hopeless, maybe having thoughts of suicide, we would conclude that maybe you're depressed, right? And so we know that depression can be treated with medication and talk therapy. And so between those two options, and some people are going to argue against medication and say, you know what, I don't want to take medication. I don't like the side effects. I get that. I really do. In some cases, they can, get through their illness with talk therapy. Maybe they take some natural remedies, and that's fine. Some people need, medical intervention, and they need psychotropic medications. And that is the best way for them to balance their mental illness. Excuse me. The same way if you have high blood pressure. You have high blood pressure, you're going to take high blood pressure medication to make sure your blood pressure is at a healthy level, right? And so that is what psychotropic medications do for a person who has depression or anxiety or whatever the mental illness is. And it's no shame in that. I love where we are, or where we have gotten as far as the way people are more verbal about mental health. That it's not a big of a secret or taboo as it once was. That people can say, people say like, girl, this bipolar is acting up today. Or, leave me alone, I'm depressed. This depression, right? Like they're more open about it. Or, I got to talk to my therapist. So, I think that is the good news, that it's not a secret. That people are more open about dealing with mental illness, because there's that side of mental illness where we have to deal with our clients who are having suicidal thoughts, and who actually, attempt suicide and have a successful suicide. And that's what we're, with shining a spotlight on mental health. We're trying to help people to say, don't live in this shame. I know I tell my clients that when I work with people in clinic, I'm glad you're in treatment because you don't have to stay home and be in this feeling of hopelessness. I'm glad you made the decision to help yourself and not just live in this feeling of hopelessness or anxiety or hearing voices or feeling like you want to die, you want to hurt yourself, that you seek treatment. And that treatment is available to people. Oftentimes, even if you don't have insurance, don't let that stop you from seeking treatment. In most counties in the United States, they have I don't know if every county, but most counties have a Department of Mental Health, or whatever they call it. You should seek them out, right? Because oftentimes they can maybe offer you a few sessions prorated or, reasonably priced or even free. So I would seek that out. If you're a college student, every college has a counseling center, and it's usually free to their students. And so I would say seek that out as an option for getting mental health treatment. Don't stay home and suffer through your symptoms. As a professor, every semester I refer a student to our counseling department because they're dealing with mental health issues, family issues that they need to have to address. And so take advantage of that. Talk to a friend. There are hotlines that you can call if you're dealing with any of these mental illnesses, or you're just feeling, some sadness, or you're going through a relationship issue. Maybe you're going through a breakup. So, call somebody, text somebody, do something to help yourself. If you have a family member and you think something is going on, teenage years are difficult years. I'm going to do a video about dealing with your teenager, right? And how to do that successfully. I'm going to talk about that and do a video on that. But if you have a family member that you think they need help, something's not right, get them help. There are in a lot of states and cities, there are crisis workers. And so if your kid won't go to service to get the service or go to an office, then the crisis worker can come to you and evaluate your child or your adult, whoever is in the home, to give like a preliminary diagnosis, like, yeah, I think something is wrong. They've admitted that they're having thoughts of suicide. We should get them to a hospital. And that's a whole nother piece. I'll probably cover that in a video also later. Just what is it like to enter into the mental health system, right? What is that experience like for people? And it's not awful, but if you've never had to see a psychiatrist or a doctor, a psychologist or a clinician, it is scary because you don't know that world. And so I like to do a video talk about what that's like, what that experience is like for people. Even kind of looking at it from my side of the desk. So that was just kind of an overview of some of the a few of the mental health diagnosis and disorders, treatment options, all of that. So there's a lot more to go through and a lot more to talk about. Please don't forget to like, subscribe, share this video with anyone and everyone, for people to learn a little bit more about psychology. Come to my page. Another video. I'm still not eating. I'm drinking. I am drinking. This is soda. But just to come over here and share some of even your thoughts with me in the comment section. Let me know what you think about this video. What subjects would you like to see me cover? What are some of the things that you are maybe concerned about or wondering about when it comes to mental health and mental health issues? I like to tie in a little bit of pop culture and what's happening in the world, and relate it back to psychology, because there's psychology in every part of our lives. Somewhere, at work, school, the home, walking in the park. I don't care where you are. I can find and I can say, oh, psychology. Like, what's going on over there, and why did they do that? So I can find psychology in almost every situation. And so, anyway, I'm going to finish this video up. I thank you for listening to the video. Please subscribe to this channel, Psychology Eats. Share it and drop a comment. You can also send me an email to psychology2@gmail.com and ask me a question. Of course, everything's confidential. And hopefully I can answer it. Also, if you're feeling like you want to hurt yourself or someone else, please get help. Call 911. Call someone. Go to the hospital, and get help. Don't suffer in silence. Thank you.